Imagine lying back in a comfortable chair. The lights are dim. Gentle music begins to play. But then something unexpected happens. You don't just hear the sound, you feel it. Vibrations ripple through your body like an invisible massage. Within minutes, your muscles loosen, your mind drifts, and your stress begins to fade away. This isn't science fiction. It's called Vibroacoustic Therapy. What if the secret to calming your mind and healing your body wasn't a pill, but a frequency? That question is at the heart of this emerging field. Vibroacoustic therapy, often called VITI, is an innovative approach that uses low-frequency sound and vibration to stimulate the body and mind. Instead of needles or pharmaceuticals, it relies on carefully tuned vibrations, usually between 30 and 120 Hz, delivered through mats, chairs, or beds equipped with special transducers. Vibroacoustic therapy works on a simple principle. Everything vibrates. Your cells, your tissues, even your bones all respond to vibration. By applying low-frequency sound waves directly to the body, practitioners can encourage relaxation, reduce pain, and improve circulation. Now let's pause here. You might be thinking this sounds like pseudoscience. But here's the twist. There is actual peer-reviewed evidence supporting it. Studies show vibroacoustic therapy can help reduce stress, improve sleep, and even ease chronic pain. Researchers are now investigating its role in conditions like Parkinson's disease, fibromyalgia, and anxiety disorders. So what does it feel like? Imagine the sensation of sitting in a car while bass-heavy music plays. Not loud enough to hurt, but deep enough to feel in your chest. Now imagine that vibration fine-tuned and targeted to your entire body. That's the sensation most people describe, like a massage from the inside out. Sessions usually last between 20 and 60 minutes. You stay fully clothed, lying on a specially designed surface while gentle vibrations flow through you. Some people combine it with guided meditation, others with calming music. Think of it as meditation you don't have to work for. The vibrations do the heavy lifting. Research suggests vibroacoustic therapy helps a wide range of people. For those dealing with stress and anxiety, studies with students and adults show reductions in acute stress and improvements in heart rate variability, which is a key marker of relaxation. For individuals living with chronic pain such as fibromyalgia, regular sessions have been linked to improved sleep and reduced discomfort. Parkinson's patients in controlled trials have shown better motor function after weeks of 40 Hz stimulation. And beyond these medical uses, many people simply use the therapy for general well-being, relaxation, recovery after workouts, or as a way to reset after a stressful day. Here's the part most people don't expect. Some researchers are even exploring vibroacoustic therapy for autism, post-traumatic stress disorder, and traumatic brain injuries. While results are still preliminary, the possibilities are exciting. Why would vibration have these effects? There are several theories. One is that low-frequency vibration stimulates the parasympathetic nervous system, the body's natural rest and digest mode. Another is that rhythmic sound can nudge the brain into states associated with relaxation or focus, a process sometimes called brainwave entrainment. And then there are the physical effects. Vibrations may improve circulation, lymphatic flow, and muscle relaxation at a mechanical level. Imagine tuning your body the way you would tune a guitar string. When frequencies align, everything resonates in harmony. Let's walk through what an actual session looks like. You enter a quiet room, perhaps at a wellness center, a therapist's office, or even at home if you own a device. You recline on a vibroacoustic mat. The practitioner selects a program designed for stress, pain, or relaxation. The tones begin. At first it feels unusual, like a gentle hum beneath your skin. But soon your breathing slows, your muscles relax, and you may even drift into a dreamlike state. By the end of the session, many people describe a sense of lightness, clarity, or deep rest. Unlike many therapies, vibroacoustic therapy doesn't require effort, belief, or even concentration. You simply lie down and let the vibrations do their work. Of course, safety matters. Vibroacoustic therapy is generally considered safe, but it is not for everyone. Those with pacemakers, epilepsy, or who are pregnant should avoid it unless cleared by a medical professional. And while early studies are promising, it should be seen as a complementary option, not a replacement for medical treatment. You might wonder why, if this works, it isn't everywhere already. The truth is, vibroacoustic therapy is still emerging. Many of the studies are small. Devices can be expensive. And like meditation or acupuncture, mainstream acceptance takes time. But interest is growing quickly, especially as people look for non-drug ways to manage stress and pain. In a world where burnout and anxiety are at record highs, what if the answer isn't more stimulation but more vibration? The future of vibroacoustic therapy is unfolding right now. Researchers are exploring specific frequencies for specific outcomes. Parkinson's research, for example, often centers on 40 Hz vibration. Clinical trials are testing it as an adjunct treatment for chronic pain and mental health conditions. Consumer devices are becoming more accessible, from mats you can use at home to wearable vibration units. This isn't about replacing medicine, it's about expanding the toolkit of healing. Imagine a hospital where, alongside medication and physical therapy, patients recline on vibroacoustic beds to accelerate recovery. Vibroacoustic therapy may sound futuristic, but at its core, it's profoundly simple. It is about harnessing a fundamental truth. Our bodies respond to vibration. Just as a lullaby can calm a baby, low-frequency sound can calm the nervous system, ease pain, and restore balance. So the next time you're overwhelmed, tense, or in pain, remember this. Healing might not just be something you take. It might be something you feel. And here's one last thought. If sound can move mountains, imagine what it can do for your mind and body.